I will call the 2021 2018 VOC full board meeting together. We will begin with the roll call. Patty, is Mike available to do that, or can you do it?
I have it, Commissioner Haw, and we'll start with you as the Vice Chair, Vice Chair Haw.
Commissioner Haw, voting remotely, Roseville, Macomb County, Michigan.
Thank you. Commissioner Romano.
Commissioner Romano, District 4, Sterling Heights, present and participating remotely in Macomb County, Michigan.
Commissioner Kraft.
Commissioner Kraft, attending remotely from Chesterfield Township, Macomb County, Michigan.
Commissioner Wallace.
Commissioner Wallace, attending remotely from Mount Clemens, Macomb County, Michigan.
Commissioner Song.
Commissioner Song, attending remotely from Warren, Macomb County, Michigan.
Commissioner Van Sickle.
Commissioner Van Sickle, attending remotely from Sterling Heights, Macomb County, Michigan.
Commissioner Zinner.
Commissioner Zinner, attending remotely from Harrison Township, Macomb County, Michigan.
Commissioner Matuzik.
Commissioner Matuzik, participating remotely from Clinton Township, Macomb County, Michigan.
Commissioner Farrington.
Commissioner Farrington, participating remotely from Utica, Macomb County, Michigan.
Commissioner Sabatini.
Commissioner Sabatini, participating remotely from Macomb Township, Macomb County, Michigan.
Commissioner Nard.
Commissioner Nard, attending remotely from Warren, Macomb County, Michigan.
Commissioner Kleinfeld. Commissioner Brown.
Commissioner Brown, attending remotely from Washington Township, Macomb County, Michigan.
There we go, and that completes the roll.
Thank you. The next item is Pledge of Allegiance. Please rise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next item is item 3, adoption of the agenda. I need a motion to adopt the agenda. Romano, adopt the agenda. Been moved and supported. Please vote.
Chair Brown, this is Commissioner Sabatini, just to amend that agenda for 4A to be dated January 21st, 2021.
Thank you, Commissioner.
That motion passes 12-0.
Excellent, thank you. Next item is item 4, approval of the minutes dated January 21st, 2021. Need a motion to approve the minutes.
Nard, motion to approve.
Motion by Sabatini.
Support, Roman. Very good. Motion's been made and supported. Any discussion? All those, please vote. Very good. Motion passes. Item number 5 is public participation. Members of the public, this is your first opportunity for public participation for those who wish to speak for a maximum of 5 minutes on any item on today's agenda. The second opportunity for public participation is for those who wish to speak on issues outside of the agenda or not presently on the agenda. For those planning to speak during public participation, please be advised that according to Rule 21 adopted by the board rules, personal attacks, coarse or derogatory language, and cursing will not be tolerated. Individuals using such language will be removed from the meeting. Also, those who are on call in by phone for public participation will be asked to speak first. Those who join virtually will be asked to put their name in the Google chat box will be called on the order in which they've been received. Staff, is there anyone on the phone or online that wishes to be heard?
Chair, there is
Anyone?
no one entered in the chat box, and I have not heard anyone calling in by phone.
Anyone else on the phone that we haven't heard from? Anyone under public participation? Anyone wish to speak under public participation? Seeing none, we'll close public participation. Item 6 is correspondence from the executive's office. We have none, so we'll go to the next item. Next item is number 7 is appointments. We have appointment of surveyor representative for the remonumentation program, Catherine M. D. Decker. Need a motion to approve
Commissioner Matusek
this
moves.
appointment. There's support.
Support Farrington.
Does any member of the board have any questions? Any questions for Mrs. De Decker? Seeing none, we'll call for the vote. Can you please post the vote?
And that motion passes unanimously.
Very good. Thank you. Thank you, Mr. Decker, for offering to serve in this role. We appreciate it. Item 8 is presentations. We have an update on COVID-19 emergency response for February of this year. Vicki Wolber, the Deputy County Executive, is here to give that presentation. But before we begin, can I have a receive and file motion on this report?
Motion by Haw.
Support Farrington.
Very good. Motion's been made and supported. Okay, Vicki, the floor is yours.
Great. Thank you, Chair Brown. Good afternoon, Commissioners. Nice to see you again in this cold, wintry weather this week. Some of our first snowfall. But the report that you have in front of you basically covers from January 16th through February 12th. Through that date, we're at day 342. We all know almost a full year that we've been dealing with the COVID emergency. Going to run through the report like I did at the last meeting and highlight some of the items, and most notably it'll be discussion on the vaccine rollout and what we've been doing in the last month. Community action, obviously they continue to be busy, and we anticipate that continuing throughout this year. They have a number of programs that are continuing. Just those through their normal systems, and their help desk that they've been operating continues to receive quite a few calls for service. Head Start is in full swing, being in the schools again and running their programs through there. Obviously the food program, financial assistance, housing assistance that they provide. And then also our senior services program, the home delivered Meals on Wheels program that they have been able to continue. We started a program for emergency care packages last year for seniors. That program is continuing, and there continues to be a great need within that area. Moving on within the emergency management department, I'm going to highlight a couple areas, and then I'm going to come back to the vaccine programs all at the end that they've been involved in. But usually we talk about our equipment and supplies and the PPE and cleaning supplies that we have within the county. That program continues. Again, entities within the county, hospitals, long-term care agencies can come to us for any needs that they have for their personal protective equipment. We're just at about 2 million items being distributed, and again, we have a cache that we anticipate will last at least through the end of the year. Another great program that they operate in conjunction with our Planning and Economic Development department is our business supply kits, or their PPE kits. That continues to be strong and a need out there that we are able to support, and we've supported over 4,500 businesses to date with that program. Moving on to the financial reports. I should have said last month, and I didn't, especially for the commissioners that are new. If it looks like you have duplicate reports in your packet, you do. What we had decided to provide last year was a copy of the budget that we're utilizing directly from our One Solution report, and then we down that report into an Excel spreadsheet where finance can add some of the commentary on the right, just to give you a better description of what those line items mean. So that's the difference. And then this year, since we ended our fiscal year in December, you now are seeing reports, obviously year-end 2020, and then where we're at for this fiscal year in 2021. Probably after next month's report, we'll probably stop needing the 2020 report, so that'll come out of the packet. So I just wanted to reference that. As you can see, 2020 revenues, we received essentially $169 million in 2020. So far in 2021, we've received just over 31 million. Within those areas, our 2020 expenditures, just over 141 million. And to date in 2021, we've expended basically 2.2 million with another 2.8 that has been encumbered and not paid out yet, but is spoken for. When you look in particular in the CARES Act report that is within your packet, again, that's the funding that was for 152 million. We are carrying that over through the end of this year. There are essentially expenditures in place of to date. We're looking at from 2020 roughly 125 million was spent in the CARES Act, and then in total 127 essentially through yesterday. So we're continuing to spend down within the CARES Act. Some of the areas where we will have ongoing spending this year, there's some money to still be paid out of our business relief program. Testing and vaccination, we have approximately 6.8 million left to spend within that area. Municipal Relief Fund, we are in the process of making payments. You'll see that roughly 10.2 still needs to be paid out. Those reimbursements have all been received. They have been processed through our emergency management office and are now in finance and essentially waiting for the checks to go out. So hopefully for our March meeting, you'll see that that line item is essentially closed. Martha Teaberry, we have 2.6 million left for them. The schools, there's just 1.2 million that we're waiting to reimburse them for. And then we have approximately 42,000 that is unallocated. In addition to the areas that I mentioned there, we continue to see anticipate expenditures within our IT department. So we have some funding left there. There are ongoing cleanings within the county facilities that take place. So we have funding allocated within that budgetary line item. We talk about all of our public information that we do. So there's money there through the end of the year. And then we have money also within our vulnerable population to continue programs in those areas. And again, since last month, we have looked at what we at least anticipate with some of the money that was left over from other CARES projects that didn't utilize all their funds, and we dispersed it appropriately between the programs that I just mentioned. And again, we're looking at those being ongoing through the remainder of the year. And of course, there are more that could come to fruition as well. Continuing in the finance, we really had no items to bring to you this month that came through for any approval. So it was a light process for February. Within the health department, obviously extremely busy. They continue to do all of their testing going on in the county. We have our testing continuing at the Baker College site. We're averaging about 100 tests per day for our 5 days a week. We still have our community sites in Sterling Heights and Warren. So those are ongoing with our partners. And we also have our strike teams that are out within the congregate care sites as they go out and do testing within those facilities. To date, since we started, we're just over 54,000 tests done within the county. For the month of February so far, there's just been over 1,200 tests administered. Last month for all of January, it was over 6,000. So when you look at that, considerable less for the positive results. And our positivity rate is now down to 4.3%. So that is very encouraging for all of us. And I think we're seeing in play, you know, some of the natural elements of how the virus operates, but also all the social distancing, all the protection practices that we are doing, as well as starting to see some of the vaccinations come through. As part of the positive cases that the health department has had, they did just over 3,200 case investigations in the last month, and they contacted just under 4,900 residents that were deemed close contacts. So that continues to garner, even though the positive cases are less, that still generates a lot of case investigations into that process and having to contact other people just to make sure that they're following the right precautions. We continue to do hiring within the health department to fill in different areas as we move through this process. So some of that has to do with the case investigation side, those contacts. We continue to hire people within to support our vaccination process, whether it's in the Burke site or for some of our outlying sites within the community. As well as we're hiring people to be our call takers and call makers within the county and trying to free up some county personnel that have been doing that. So that proceeds. Still a lot of inquiries within their help desk within a month. Or received 10,500 calls. Averages almost 500 calls a day. It's quite a bit of calls coming into one department, but obviously we all understand that there's a need to know. There's a lot of questions out there, and they continue to man that and do a really great job with their personnel. Again, the vaccine, I'll highlight all at the end and pull some of their stats out. But just to pull out in their last bullet point within their part of the report, they continue to work very closely with the school districts in the county. Just got off a call today that they had with the superintendents and the MISD gearing up for the March 1st reopening and trying to make sure that all the schools have the information that they need from the health department, what they do with cases and contacts, and trying to put them in the best position to not only open for some of the districts that have not started face-to-face yet, but to stay open. And then we'll see where we can support them through that process. Human resources and labor relations. I mentioned the hiring earlier. Obviously, they're an integral part of that in helping not only utilize staff throughout the county to help in some of these situations, but also for the outside hiring or contractors that we need. So they've been greatly supporting that process. They continue to do a lot of the work with the employees in the county and our response for our own personnel that become sick. They help manage the COVID-19 email group with a number of people too. So they're doing a great job with that. And for the people that they are onboarding, we've had to create not just a normal orientation program within the county, but also some specialty training programs. So working with experts from the health department and then within their own personnel, they've created some really great programs that we're happy to launch and have in place when people are brought on board. Information technology continues to be busy. Again, they're tied in extremely well with our vaccination process and all the work that we have going on there. And in particular they had the most CARES Act projects, as you can imagine, with 61 projects of their own. 53 of those are now completed to date, with a number of them that will wrap up quickly, where they just have to make some payments, do final sign-offs, and make sure that everything is in place. So they're moving along well within the IT department. Joint Information Center and our JIC, or Public Information, our newsletter folks continue to grow. I think that's amazing, going on for a year. You would think most people would know that we're out there, but within the last month, we've added nearly 6,000 new subscribers to that newsletter. So there is definitely a continued need for information coming out of the county, and people like to get that direct and from a credible source. So that distribution continues. We've held a couple of press conferences in the past month that I'm sure you're aware of, most notably the one out with Richmond Lennox and SMART last week. They helped to continue and supporting our COVID-19 email group as well. That group had over 407 emails this past month, and then we have a COVID partnership email group that's intended for municipalities, some of our larger partners and partner organizations, and they had 149 of those inquiries that they helped to manage. In regards to the JIC and our media center project, we knew starting this project that there might be some long lead items, as just about everyone has experienced with COVID. Obviously, you have businesses that are shut down, so production's been on hold. So we had anticipated that project closing out the end of this month, beginning of March. But because of some of those long lead items, it's now looking closer to the end of April, beginning of May. And again, that's really based on manufacturing and getting those items through the pipeline and then delivered to us. Otherwise, that project is running smoothly. There's haven't been any critical bumps at this point in time. So we're glad for that, and we'll just be patient, obviously, for that project to complete. Moving on to our Planning and Economic Development Department, one of the highlights, again, that you've seen is the MEDC Survival Grant that the county received, roughly $4.1 million through that program. That was a quick turnaround program. That is in reference to the email list I sent yesterday for the different businesses that received grants under that program. That is another process we will continue. If there are other business grants that come in, you will routinely get a list from our office of who those awardees are. Again, being creative, today they were at the admin parking garage in anticipation of the weather. We moved them to the parking garage so they could have some protections. 400 checks were passed out there today. So that was a really great effort by them to allow those people to pick them up and not have to wait for the mail delivery to get those out. They continue to meet with the Economic Recovery Task Force that they put in place as part of COVID in handling the various needs within the business community. Again, they see value in that, whether there's grant funding on the table, and there's a lot of support and a lot of information that continues to come from those groups that participate in that process. I'm going to move on now to just a healthcare hospital update. Hospital cases continue to decline. We are now seeing sustained decline within that area, which again is great to see, so that not only benefits the people that are affected by COVID, but obviously helps with the overall response of the hospitals and with their staff and keeping those numbers down and being able to take care of thousands of other people that come through the hospital system with issues non-related to COVID. So we're glad to see that that continues that trend, and it's a strong trend downward. Within the past month too, we were able to schedule and conduct 3 out of 4 hospital meetings with the hospital systems within the county or affiliated with the county, and we have one pending that we're hoping to schedule in the next couple weeks here. So we continue to partner with them on a regular basis. And then basically our current long-term initiatives essentially remain the same from last month. And probably just an item to highlight a little bit, though nothing is finalized. is the information coming out of the federal government that there, is the potential for another substantial round of money to come to not only the county, but many jurisdictions within the county would be able to receive direct funding with what is in front of Congress. So we are tracking that. We're tracking other grants that are coming in as well, but probably that's the most notable one that we are looking forward to seeing. And then with that, I will concentrate on the vaccination planning that we've been doing. We've been extremely busy this past month. We made a lot of great gains, got a lot of our plans that we had been talking about and planning out on paper actually have come into fruition. So there's an extensive process that we do for our vaccine strategy and rollout. Obviously that involves members from the health department, most notably April Walton and Tom Barnes within that office are leading that, Brandon Lewis from emergency management, and then there's a whole host of departments that really take the time and the effort to have these plans come together. Everything that we do for the vaccine sites is dose driven. We talk about it, you know about it. So there's a lot of planning that we do, but when we actually pull the trigger on a site or a model that we're going to use, it's all dependent on the doses. There's a feeling that we have that, yes, it's strategic. We look at a lot of different factors, but again, it goes to that dose allocation and which sites we open, what amount of doses they get, what their throughput is. So the various models that we have are the congregate care sites. We've talked about that a little bit. We have shared our list with the commissioners. There are roughly 400 to 500 congregate care sites within the county. Majority of those are covered with vaccination agreements with private pharmacies. There's approximately 67 that are not. So those are the 67 that we are responsible for within the county. So we have, again, used a strike team approach to work on those congregate care sites. To date, we have gotten 4 sites done within the county and vaccinated roughly 400 people through that program. So that's a little different model. We have to do some planning with those sites, make sure that the sites are interested, make sure that their people get the information who are interested, make sure that they get registered. We have to obviously track the doses, but there's the transportation, the storage while we're out there. And then obviously we have to plan to go back out for the second dose to those sites as well. So we are moving forward with that program. The other program that we talked about and actually launched, as you know, last week and talked about, and it started Wednesday of this week, is our drive-through model. We partnered with Richmond Lennox EMS and Smart Transportation. That's just a wonderful program. We worked very hard on that. It goes to show all the expertise and the time and the creativity of people using our relationships and partner organizations. I don't know if you're able to see the clip from Channel 4 yesterday. I know myself and someone else actually brought tears to our eyes to be able to see the people that we were able to service there. And that was our intent. We talk about obviously the senior population. Right now, that site is designated for seniors out in Richmond Lennox. We partnered with SMART for the transportation issue to help to get seniors there. Obviously, there's mobility issues. And we knew that going in, even when we opened up the VERC site. So this greatly has helped us solve a lot of issues for people to get to that site. Obviously, partnering with Richmond Lennox EMS, it's one of the things that makes some of our choices easy. Richmond Lennox EMS has long been a partner with the health department in running flu vaccination clinics. So again, that was a very easy transition to run a COVID clinic there. One of the other areas that we look at with the site is what else maybe the partners are able to bring to the table. And Richmond Lennox EMS is essentially staffing that site for us. through the funding that I mentioned earlier. We're able to reimburse them for that. But that's a huge hurdle. And if a partner organization can help us with that, it makes it that much easier to choose that site and get that site up and running. So we have minimal staff out there at the Richmond Lennox site, and but the majority of that is staffed by Jeff White and his personnel. So we're very proud of that site. Right now, we're averaging about 100 people a day at that site. We know we can do more of that, but again, that goes back to doses. We were surprised last week how much our doses were reduced. So very quickly, we generally find out on Fridays what our dose allocation is, and then we have to plan for really getting ready for Tuesday when our appointment line opens, and making sure that we have the different formats and spreadsheets that we use for appointments. Really happens within a couple days, and we have to get that set up so we can have those appointments ready to go the following Wednesday. So yes, a little less going out through that site right now, but we know we can do a lot more out there. And again, their drive-through site, we plan on keeping it going. It's not going to be just for seniors. Our goal is that eventually, once we get through more of the senior population that want to be vaccinated, obviously that will be open to more of the public and those that are eligible. I think it was great to see. I know there's always questions. You know, you open a site in the northern end, you open a site in the southern end. We saw some of the comments on social media. You know, how do people get out there? And again, on you know, with the Channel 4 clip, it was nice to see that people from I believe it was Roseville and East Point and the southern end of the county were getting out there and taking advantage of that site and being able to travel there. And again, whether it was on their own or a partnership with Smart is taking people from all over the county out to that site. It's not just necessarily people focused in that area. So again, that's a model we want to copy in other areas of the county, but it's just pulling those partners in and pulling those in at the right time. Our other model that we are looking at is very much the same as a VERC site, where it's an actual facility. So we have a number of contacts within the community where we're looking at doing those sites. The next one that we're furthest along with is City of Sterling Heights. They are essentially ready to go. But again, vaccine dose dependent, we may not launch that site. Or if we do launch that site, again, you may only see 100 doses, 200 doses going out of that site. Not ideal. But in some ways it kind of helps. It gives us, you know, if there's lower doses at first, it gives them some time to actually work out any kinks or any of the processes as they move through. Again, Sterling Heights is a big partner. They, again, are providing the location. They are going to provide the majority of staff from Sterling Heights for that site. They are helping to do some outreach for the people to go to that site. Again, we are looking at targeting seniors out of that site at first. So they are helping us with that process. So dose dependent, we could go with that site potentially next week. But we will have to figure that out once we know what our doses are. Obviously, there is also then the partnership with Meyer. We partnered with them over the past couple of weeks, where we are providing doses from our allocation to Meyer. And basically from that point on, they handle the entire process within their stores and their system. Obviously, it's all their people. It's their appointment system that they manage and handle. We have access to the data. We have access, or we have input, obviously, and I mean, you know, direct input on what store locations we want the vaccines to go to. Last week, when they shared with us the aggregate number of registrations, I think even before we announced the program, and just through their own marketing, there were roughly 55,000 people from Macomb County that were registered. Just under 13,000 of those were seniors at that time. So again, we asked them to target those 13,000 seniors and following CDC and state guidance and the Social Vulnerability Index. We also targeted specific areas and specific zip codes. And that is who Meyer was inviting to come and get a vaccine for when their sites are open. So there is all that planning, there is all that communication. We are very conscious of that. We're very conscious of who we need to get to. We're conscious of the access issues for people, and all of that is taking place in all of the planning that we do, and it's quite comprehensive. You know, we can be nimble, obviously, and move these around, but they are still time intensive with logistics. There's site walkthroughs for some of these sites that we have to go to. Again, if we have to bring in our own personnel or partner with EMS agencies, that makes a difference there. And then when we look at all of these sites as well, we've implemented some different appointment systems, as you've noticed. So while we have our VERC site and the normal online system plus call-in system on Tuesdays, as I mentioned, Meyer is a different system that is in place. And again, that's open to anyone to register. And in essence, because I know the question's out there with Meyer, we have created a wait list. That is now a wait list that people have been asking for and wanting. So there's a wait list out there. And then also with our partnership with SMART and Richmond Lennox EMS. Can't say enough too about SMART, not only on the transportation side where we're looking for that help and support, but really in our initial conversations with them, we never thought that they'd be able to support us with the call center. So they are actually taking calls for us for seniors. They are handling the initial calls. It's the smartphone number they call if they're interested. There's an email out there. They vet the callers for us, and if people are interested in the vaccine, that list comes back to us. And then we have personnel that are now, instead of just call takers, they're actually call makers. And we're calling those people individually to schedule the exact time and appointment. If they request that they would like a ride from SMART, we then turn that list back over to SMART, and SMART will contact them to make those arrangements. So again, there's another wait list that is created on the SMART side right now, focused on the senior population. But that is another wait list that we were able to create and give people an opportunity, if they chose to, not to have to go through the Tuesday system. Obviously, they're welcome to do that, but we've made it much easier for people in both those regards. Also, just we are we've partnered with Rite Aid and at least sharing information. They have now come online with getting doses directly from the federal government. We've been in contact with them, so we're aware of what sites in the county their doses are going to. So there is a partnership there. Again, they have a sign-up system very similar to Myers. So there's another opportunity for people to sign up for the vaccine. So we're very happy for all of that is going on and seeing some of that expanded accessibility, if you will, and ways to get on different lists and sign up for the vaccine. I just want to highlight somewhat where we're at when we talk about our senior population and some of the numbers just for doses administered. For the county itself in total, with all the different agencies that are able to provide vaccines, so whether it's our county health department, whether it's Meyer or Rite Aid or any of the hospital systems, essentially to date, there are 127,106 doses that have been administered throughout the county. The state tracks that. That's based on residency. So that's how many residents have received doses within the county. Of that number, we have just over 37,000 doses ourselves through the health department have been administered to date. When you look at our numbers for the senior population, within the entire county, and utilizing that 127 number, roughly 38% of the people receiving those doses in the county are seniors. When you break that down just to the percentage out of the number of doses that the county has allocated, we are just at over 60% of our doses going to the 65 and older people within the county. So I just wanted to share some of those data points with you as well. And I believe I covered everything that I had wanted to cover in the presentation today. So thank you very much for the time. And of course, I'm happy to answer any questions, and we have other people on the phone as well that can help.
Thank you, Vicki. Thank you for that detailed report, comprehensive as always. Commissioner Farrington.
I removed my name from the list earlier. Thank you.
Okay. Commissioner Romano.
Thank you, Chair. Hi, Vicki.
Hello.
Again, I have to compliment you on the way that you're giving the information back to us, so we can give that information to our constituents. But if I may take just 2 or 3 minutes for the commissioners, I had the opportunity yesterday, naturally, just recently being a senior eligible. I wish. But anyway, I was eligible, my wife and we had the opportunity yesterday to have our shot, and we went to the Vermeulen building. And if I may, I'll take a moment and just walk you through it, so that maybe in case your constituents ask, you can give them some information of how it goes about. Our appointment was originally set for 12:45. We actually arrived about 10 minutes early, pulled into the front parking lot, more than enough directional signs showing COVID vaccine with the arrows pointed. We followed the signs to the back parking lot, large parking lot. We parked our vehicle, walked into the front of the building, and there was a line there originally. We walked in the front of the building. The man verified for my wife and I what time our appointment was. We went to a second station. The girl also had us waiting there to verify the fact that we were on the list. They verified that with our driver's license. They proceeded down the hall. Again, we were in a short line. They had probably, and I don't remember, but somewhere between 12 and probably 15 stations of nurses with shots ready for people waiting in line. I received my shot. My wife received her shot. Incidentally, those were the Pfizer shots. They directed us from there into the outside and inside a heated, large tent where we had to wait for 15 minutes to make sure that we didn't have any allergies or any reactions to the shots. From the time it took us to walk into the building, and from the time it took us to get back in the car, if a half hour transpired, it was a long time. So when your constituents ask you what's the procedure, what's going on, honestly, they have it down to nuts and bolts. It's no muss, no fuss. Vicki, I congratulate you and your staff and the people that set this up. Honestly, it was so easy. It's just, I can't even believe how simple it was. And that's my story, and I'm sticking to it. Thanks, Vicki. We appreciate you. Thank you, Chair.
Thank you, Commissioner Romano. Commissioner Haw.
Thank you, Chair. Hello once again, Vicki.
Good afternoon.
Thank you for the very in-depth report covering all the subjects. I just want to make 2 comments and then a question for you. Similar to Joe's experience, I had 2 seniors from Roseville actually stop by the house and indicate how professional, friendly the facility in Macomb was, how expedient it was. They were right on time, and their indication was it was less than a half hour as well. So please pass on those congratulations. I also ran into another individual that was utilizing the Roseville facility and said Macomb County is doing everything they can at an excellent level. I did talk to Mark yesterday, and for the other commissioners' information, the 4,100 dosage that we had received from the state were committed within 9 minutes. And he said the lines are overloaded. The fact that we put in those new lines are getting notification, and the phones are being answered. Let's put it that way, because my wife actually made 91 phone calls and got the same message 91 times. So she's very committed. We're on 5 different lists, by the way. So that's the difficulty that's being experienced. The question I want to ask you is going back. I thought we were told back in November that CARES Act money from 2020 could not be carried over to 2021. I thought you indicated, has the protocol with the feds changed, or is it our interpretation of the protocol?
No, it changed in December, Commissioner Ha, and they have now extended the use of the CARES Act funds through December 31st of this year.
That's good to hear. At least they're doing something correctly. So thank you for that. That's all I have, Chair.
Thank you, Commissioner Ha. Commissioner Song.
Thank you, Chair. Hi, Vicki.
Hello.
Thank you for your thorough presentation. I just have 2 questions. The first one is regarding the CARES Act, February 16, 2020 document. Could you clarify the vulnerable populations and how do you determine the amount for that category? I saw that there was more originally allocated, but it kind of tapered off.
Sure, that has been based on the different projects coming through those programs. Majority of those projects have come through our community action agency. So, you know, initially when we went through projects, I think, you know, their initial request was maybe 15 million when we started this process. And so they had a project list, and then they start working through the project list. And they start trying to see which projects can actually be realized within the time frame. So some projects are removed from the list if they couldn't be done. Again, it wasn't until December that we found out money was going to be extended. There are also other funding programs that have come into play for some of the community action programs that are out there. So with, again, that 10 million that we had left over, if you will, coming from out of our December deadline, we decided to essentially allocate 1.2 million to that program. There's a couple programs we're looking at extending that we did start last year, one notably for the seniors program. So that's something that'll probably be coming to the board next month for you to approve and look at. There is another, we were working with utility companies for utility assistance at the end of December. At that time, that was a program that we couldn't launch based on some of the parameters with utility companies. So now we've set aside funding to potentially go down that road again with the utility companies. So right now, those are the 2 major programs that we're looking at for roughly, I think it's that 1.2 million that is left in that category.
Thank you. I just wanted to make sure none of those fundings were going to be pulled into other categories, because I think it's important to help our vulnerable communities. So thanks for that explanation. So second question is, how are you ensuring equitable distribution, and what is the county doing to increase that outreach to communities with high social vulnerability index, which is the SVI that the state is factoring in? A concern that the fact that we received less doses is telling me that maybe the state is not considering Macomb County as reaching these vulnerable communities. And you talked a little bit about the seniors in that list and pulling different zip codes, but beyond that, what else is being done? And is there any outreach to these communities and also to the state so that we can get more doses?
Yes, I'll answer your last question first. Yes. We consistently have weekly discussions in multiple forums with the state about our doses. They have a tool and a matrix that is out there that has been explained to us, but we never see the results of the matrix on any given week. So while they say there's a tool and this is how it works, and oh, Macomb, here's your dose allocation, we never see it in comparison to the rest of the state. And yes, there are questions on why different communities are getting the dose allocations that they are. But we don't actually, aside from verbal talking to another community, eventually it appears on the state's website, we don't actually get to see that matrix in play. So if you hear us talk about that and that we don't know how it's being allocated, yes, we understand the tool, but it really comes down to seeing the actual results of that tool in use, so that we know that, yes, they have us marked for this much in population, so we're getting this many doses, and our SBI number is this, so we are getting this many doses. We've never actually seen that. So again, we believe, one, we'd like to see that, and that there is some disparity. So yes, we continually have that conversation with them. Yes, you referenced the Meyer, and while that's geared at seniors right now in that area, that's some of the same methodology that we are utilizing. We have had recently some conversations with the state, and one is recent today, that they are going to be launching a new program, reference the SVI, and actually asking us for what doses we would like to see and what our plans are for our SVI. So there are a number of partner agencies that we've talked to, or in this case, aside from our municipalities and some of those higher SVI regions, areas that we've reached out to create plans. We are also looking at contacting other community organizations. We have outreach, for access. We have different church organizations that we have outreach with that we are planning on getting to. We've done a couple of town hall meetings in East Point within the past couple of months, and that is part of our plan and program to look at those. As part of the SVI is obviously the age category, but transportation is a huge one. So again, the partnership with SMART is part of that. In the last month, we piloted a program to try to get vaccines to homebound individuals and individual residences. Unfortunately, because of the vaccines that we have, the pilot program brought about a lot of cons. So while that's not a program we can run right now, that is a program that if we are able to get the Johnson & Johnson vaccine, which is a single dose, comes in its own vial, and doesn't have the storage capability. We at least now have worked out the kinks of that homebound program. It's just getting the right vaccine to match up with that, where it's not as complicated. So there's a number of initiatives that we have in play or can be quickly adapted for that, to ensure that we are reaching those SVIs. We talked as recently today too, part of it is not, just getting the doses to the right people, and, accessibility has to do with the education component. So we talked today, again, the town halls were a little piece of that, but again, doing outreach like that, getting some of our materials out there in different languages, setting those up. We talked today maybe about setting up some Zoom meetings or putting some trainings on our website. That people could see that. And some of it too is if we go to launch a site and we are particularly targeting an SVI, is maybe before we launch that site, maybe a week or two before we actually have those education sessions. So those are the discussions and the planning that are taking place and ever evolving with what we're doing.
All right. Thank you, Vicki. Thanks for sharing that. And thank you, Chair.
You're welcome.
Thank you, Commissioner Song. Commissioner Kraft.
Thank you, Mr. Chair. Vicki, good to see you. Thanks for the report again. I want to echo what some of the previous commissioners said. 5-star rating from anybody that I've heard of that has gone through that process to get vaccinated. And I know our staff catches a lot of grief with, making the appointment, but once they get to that point and they make it through the process, I've heard nothing but rave reviews. So please pass that on to your team of how grateful these folks are that have gotten the vaccine. My question to you is, and going back to seniors a little bit, is there any way that we are utilizing Meals on Wheels lists or anything like that to reach seniors to get them vaccinations or get them on a list somewhere? You know, folks that may not have the means of a computer, things like that. You know, just curious if we're utilizing that or if we even can utilize a list like that for vaccinating the seniors.
Yes, we can, and yes, we are. The Meals on Wheels part of our there's the list for that in general. That is the list that when we are able to roll out the homebound program, that actually we were going to use as our starting point because they know the individuals that are actually homebound as part of that program. We have made contact with the, not only our Office of Senior Services in general, but then also local jurisdictions, senior centers, and have requested lists for them. And if they could put them together with us and feel free to share those. We used the SMART list. Their list is one of the lists we started out with too, to make some of those direct contacts and phone calls. So yes, that outreach is ongoing.
Great. Thank you, Vicki. Thank you, Mr. Chair.
Thank you, Commissioner Kraft. Commissioner Matuzik.
Hi, Vicki. Thanks so much for the detailed report. I really appreciate that. And I echo what Phil and others have said. When people get an appointment and show up for a shot, they have nothing but rave reviews. And I also want to thank you for your team's ability to answer the questions that I forward that I get from constituents. Sometimes they ask me a question and I'm like, I am clueless about this answer. So I really appreciate that. Commissioner Haw, I got to tell you, I got you beat. I did 114 redials in 30 minutes on Tuesday. Did not get an appointment, but something has clearly changed with the phone system. And the biggest complaint I got on Tuesday afternoon was that people connected, got a message saying you're 120 people in front of you, and then immediately got a message that said, oh, there's too many people, call back later. That seemed to really make people angry. And if that's a change we instituted, we needed to fix that because people were really frustrated that they finally got through, but then didn't really get through. So I hope we can fix that.
Yes, we understand that happened. We made one change to improve the system, and then not until it went live, do you realize some of the changes you make. So yes, the vendor is working on that this week, and we just discussed in a meeting today that if they don't feel it's corrected or satisfied, we're going to pull back that change. So yes, that was unfortunate, right? That it's not supposed to happen that way. So no, we're aware, we're working on it. And again, if it doesn't work, we're going to pull that change back.
All right. Thank you very much. That was the main call I got on Tuesday afternoon from constituents. They got hung up on. I will say that I too am on many lists all over the place and have actually secured an appointment on a Rite Aid list for early March. So I'm feeling better.
Good. Good. And sorry, I forgot one piece in my report. Just talking about the lists. Too, just in the partnership with SMART, where they are now the call center and taking appointments. Just I think that's been open 2 or 3 days. They've already had 1,000 people call in. So again, very, very successful. So sorry, I forgot to say that. And just one more piece is thank you for all the congratulations and kudos on the site. A lot of work, and obviously that really goes to Andrew Cox and his personnel, and maybe a name you don't hear that I'd like to mention is Cheryl Woods is the vaccination coordinator. She's been with the health department a number of years. Cheryl keeps us track on our doses, so when we hear some of the stories of some of the misappropriations or miscalculations of first doses and second doses, or scheduling too many appointments. Cheryl keeps us on track for that. And yeah, she's in charge of the site with her public health nurses. And she just does a wonderful job, as do they. So just like to say that as well. But thank you. We will share that with all of them.
Thank you, Vicki. Thank you, Commissioner Matuzik. Commissioner Wallace.
Thank you, Chair. Hi, Vicki. How are you?
I'm good. How are you?
I'm doing pretty good. Thank you so much for your report. Most of the commissioners have asked my questions, so I'm just going to take this opportunity quickly to make sure my notes are correct. So I know with the health department, we still have the online, and we have the number that they can call on Tuesdays. But now we have Meyer, who has a list that they our community can get on. Rite Aid may possibly, well, we know they will be coming on, and as Commissioner Matuzik said, she's on that list, so they also have a list. And then the Smart has a list as well.
Yes.
Okay. All right. So those are 3 lists now that our community members can get on, and we can promote them in that way. And then so with all of these lists, are they, like I believe you said with Meyer, they're reaching out to the most vulnerable or the seniors first on the list? Is that correct?
Yes, and they're doing that because Meyer is getting doses from the federal government and the state. But then we've also given them 2,000 of our own doses as a partner. So one of our first questions when they said they were willing to help us is if we give you our own doses, will you target them to certain groups and certain stores? And they said yes. So with that program, we are able to target, and they utilize our doses in the way that we ask.
Okay. So, I mean, that's great to know. I know we've really been trying to push for this list, and I actually heard from someone in Oakland County that said they keep signing up on the list and keep getting lost somehow. So there are, benefits to each. And I really want us to be able to promote, however is best for our community as well as the health department. So I think having these options are really great. Do you know, and I'm sure you've touched on it or don't know, how much have our dosage went down compared to last week? I know you were saying the dose amounts that we're receiving has decreased.
Right. I think 3 weeks ago, we were right around 7,000. Then the week after that, I believe it was 5,700. And then last week, it was roughly 4,600. I know, Andrew Cox, you're on the phone. Is that correct?
Pretty close, Vicki. I'll give you credit for being close, but so I was letting you go. You should have just kept going with it. 6,250 last week. For this week, 4,700. So that's a 25% reduction.
Oh wow. Okay. That's a lot considering.
And I would say, Commissioner Wallace, that the reason that was explained to us from the state was that they were covering other providers that had mistakenly given their second dose allotments to first dose appointments. And so the state as a whole ran into logistical problems with people not being able to get second doses. As Vicki mentioned, that was not our site. Cheryl Woods has done a spectacular job and the team there. So that was not us, but unfortunately we had to somewhat pay for others in those areas.
Wow, that's extremely unfortunate, especially for the, our Tuesdays when people are calling and, there's nothing we can really do because we only have so many vaccines to give. So thank you for that. It's good to know because we're trying to keep everyone as up to date as possible. And again, I asked this question to you last time. Is there anything that you see from us that we can do for you to make anything a little easier.
Get us vaccine.
I wish.
Not to be overly simple, but I think the more that we advocate, you're exactly right. We can have these partnerships, we can have the ways to split it, but unless we have vaccine, it means nothing. And so I think we've been, I guess extremely frustrated is probably the best way to describe it with the amount of vaccine we're getting, because that can only go so far in so many groups. So we need vaccine.
Yeah, I absolutely agree. I have seen, like in my community in particular, I've heard so many people question the vaccine. They're scared. They don't know what to expect. So I'm trying to push the vaccine and tell them, let's get this. We want to be able to move freely. But then, of course, there's not enough. So it's kind of like I'm going in circles, but I understand your part, and I will continue to just, promote what we have and keep everyone up to date. So I thank you both for answering my questions and for your time. And thank you, Chair, for this time.
Thank you, Commissioner Wallace. Commissioner Sabatini.
Thank you, Chair. Hi, Vicki. Hi, Andrew. Kudos to both you and your team and everything that you're doing. Pretty much all my questions have been answered. I'm the last one on the list here, I think, to speak. So that's a good thing. So I see all the commissioners have the same thought process as I have. My questions were regarding the partnerships and the waiting list. So thank you for getting those waiting lists created. I think that helped a lot in this process, and the partnerships working with Meyer and Rite Aid, and clarifying, who's getting the vaccines, whether it's coming from us, they're getting them directly. So thank you for all that. One last question, it dawned on me the other day was, as we get through this process and we're partnering everybody, and then, different segments of our population are going to be, getting vaccinated. Do we look at all into the My Chart app? I know like the two largest hospitals in our area, like Beaumont and Henry Ford, use that app. And I'm just wondering if Macomb County, if like the health department, if we use that app at all, or did we look into that? Could that help our operations at all? And I didn't ask it last month because it dawned on me the other day when I was scheduling an appointment, and lo and behold, I used My Chart to do that. And, we're talking about all these lists, and everyone's on all these lists, which is great. I'm just wondering, with that app, would that help us in any way, shape, or form?
Commissioner Sabatini, we can, we're definitely open up to different technologies and exploring those different apps. I'm aware of it. We haven't had a whole lot of time to, look at that. I know some of the healthcare partners are using that. So it's definitely something that we're always, just so that you guys all know, that we're always looking at the ways that we can make the experience better and interface with customers. With any kind of technology, you also have to think about the implementation and how quickly we can get that up and running. And then also the technology experts that are there to run it, and are they familiar? Because oftentimes it takes time for them to get up and running with that and be familiar with it as well. We currently have our own EMR, electronic medical record system, Mitchell and McCormick. It's an okay system, I'll say that. It does fine. We'd like to look at maybe improving that system. Probably not the best time during COVID to do that, and I don't think Cheryl Woods would probably appreciate that too much, adding that to her plate right now. But maybe down the road, how we can integrate the EMR systems and how they connect to the hospital systems has always been a challenge for local public health. And it's been a challenge for healthcare systems. They can't even, talk to themselves. That's always been a struggle and challenge statewide, something that's been talked about for years now. But it's a really good question. We'll look into that.
Thank you, Andrew. I appreciate that. And that concludes my comments. Thank you, Chair.
Mr.
Thank you,
Chair,
Commissioner Sabatini.
Mr. Chair, this is Barb Zinner. My request button isn't working. Vicky, is there a reception place for the vaccine in St. Clair Shores? I thought there was, but you didn't mention it. I thought you did before. Maybe I'm mistaken.
No, we don't have anything at this time set
Okay.
up within St. Clair Shores.
Thank you very much, and thank you for all that you do.
Thank you. You're welcome.
Thank you, Commissioners. That's all the Commissioners have on my list to speak. We have a motion that's been made and supported previously. Please, Michael, please post the vote.
That motion passes 12-0.
Thank you. Next item is a we have committee reports. We have a series of agenda items now from government oversight, health, community services, and others. Each of them have items on it that were reviewed during the committee meeting and approved and forwarded to full board. This is an opportunity for you to ask questions of items that you maybe had in committee or were waiting for information in a committee. But these are a series of items that we're going to, this will be the final reading, if you will, of these resolutions that were passed in the various committees. And the first one is Government Oversight Committee. Commissioner Haw?
Chairman, after extensive discussion on all three of the items, I'll make the motion to approve A, B, and C together.
Support, Farrington.
Mr. Chair, this is Commissioner Kraft. I would request that item 9A be separated.
All right, very good. Item 9A will be separated. Any other question on the other two? Seeing none, we'll have a vote on items 9B and C. Michael, if you'd please post the vote.
The motion for 9B and C passed 12-0.
Very good, thank you. Item 9A, Commissioner Kraft.
I'm not going to make a motion because I'm abstaining.
You're moving to a state.
I'll make the motion to approve 9A.
Support
Romano.
Any discussion on that item?
I will, Mr. Chair. Just as I did in committee, I will be abstaining again just because I am on the CMH board and would be receiving the compensation. Thank you, Mr. Chair.
Thank you, Commissioner Kraft. Thank you for that clarification. Please vote.
That motion passes 11-0-1 with Commissioner Kraft abstaining.
Very good. Thank you, Commissioners. Item 10, Health and Human Services Committee. Commissioner Zinner, this is your committee.
I make the motion to approve all the items previously approved on my committee.
Okay. Is there support for that?
Support, Haw.
Commissioner Haw. Does anyone have anything on that item that they'd like to discuss or separate? Don't see anyone. Please vote.
That motion passes 12-0.
Very good. Item number 11 is the Internal Services Committee. Chairman Van Sickle.
Thank you, Chair. I'd like to move that we approve items 11A through D.
Support, Farrington.
Support by Commissioner Farrington. Thank you. Is there any discussion on any of those items? Please vote.
That motion passes 12-0.
Thank you. Item 12, Public Services Committee. Chairman Farrington.
Yes, thank you very much, Mr. Chair. I'd like to make a motion to approve all items previously approved in the Public Services Committee.
Support Romano.
Any discussion on that item? I don't see any. Please vote.
That motion passes 12-0.
Okay. Item 13, Records and Public Safety Committee. Chairman Romano.
Thank you, Chair. I'll make a motion to move items A through F. If I can get support, I think we've had long discussions on all of these. Thank you.
Support Farrington.
Support by Farrington. Is there any discussion on any of those items? Don't see anyone. Please vote.
That motion passes 12-0.
All right, thank you. Item number 14 is resolutions. We have a series of resolutions, A through D. We'll take these one at a time. I think it's best. If I need a resolution, I need a motion for item 11A, resolution supporting a Macomb County vaccine waiting list for residents. Motion by Commissioner Song. Commissioner, would you like to make that motion? Commissioner Song?
Yes, Commissioner Song, motion.
Support Haw.
Support for that. Is there any discussion on this item?
Mr. Chair, Commissioner Haw.
Commissioner, go ahead.
Thank you, Chair. I would like to thank Commissioner Zong and Commissioner Kleinfeld. They have been discussing this item since, since Commissioner Zong got on board. Veronica brought it up last December, and working together collectively, which is what we do as a team in Macomb County, we were able to put something together for this vote. So thank you both. That's a lot of hard work that should be recognized. That's all I have, Mr. Chair.
Thank you, Commissioner. Any other discussion?
Yes, Commissioner Song.
Come here, Commissioner Song, please go ahead.
Thank you, Chair, and thank you, Commissioner Harold, and Veronica, who was supporting it too, but wasn't able to be here today. So this resolution is something that we've been working on for a few weeks now, and I had hoped that the current system with residents calling in to make appointments would be improved. And so this was actually done prior to the SMART and the Meyer announcements. So I think the passing of this resolution just reaffirms that we as a Board of Commissioners support having a waiting list. And so I hope you'll consider voting yes on this. And I think it's wonderful that we now have these partnerships with Meyer and SMART to reinforce this. So as many of you know, we've been getting over 100,000 calls from residents every Tuesday. And my concern initially was that these residents will eventually just give up because they won't be able to reach us. And so I think having a waiting list will help alleviate some of that. And so I hope you'll consider voting for it as a sign of solidarity and approving this resolution to show a sign of support for these types of initiatives, and that we hear our residents' concerns and their frustrations, and that we're working together towards a better solution. So thank you.
Thank you, Commissioner Song. Anyone else? I don't see anyone on the list. Michael, please post the vote for it.
Commissioner Chair.
Oh, I'm sorry. Commissioner Zinner, I'm sorry.
Now on your resolution, you didn't have an explanation of what the list would be, did you? Commissioner Song?
Could you clarify that?
Well, what kind of list would you have?
We left it pretty open for the county and the health department to determine that. I think the general idea of the resolution is to encourage some sort of waiting list. I know right now with Meyer and Smart, they're focusing very much on seniors. But I think it would be great to kind of expand that to vulnerable communities besides seniors too. But it's not very specific, and we have left it pretty open as a recommendation from the board to the county.
Thank you.
Thank you. Anyone else? Seeing none, please vote.
Chair, I think Julie, Commissioner Matusik had a question.
Oh, I'm sorry. Go ahead, Commissioner Matuzzi.
It wasn't a question so much as a statement of support. We are treating people so disrespectfully on Tuesday mornings, where, like I said, I made 114 redials on my smartphone in half an hour. We have people who aren't capable of doing that sort of sit there and make phone calls for half an hour. We have people that become so angry. I know you have all dealt with these questions as well as I have. We just need to give people a sense that they have signed up for something and then get a phone call to schedule an actual appointment when we have vaccine. We are just treating our residents, I think, incredibly disrespectful. It's a free-for-all on Tuesday morning, and that just needs to stop, in my opinion. Thank you.
Thank you, Commissioner Matuzzi.
Excuse me, Mr. Chair. I think there should be a list also, but I don't see where people are redialing 100 times. Honestly, I just don't get that, because it just ties all the lines up, and I don't understand that myself. I understand elderly people having a problem with it. That's what they do. I don't understand that myself. So I have respect for whatever anyone wants to do, but I think giving them a list without some kind of direction just may, I don't know what they'll even do with it. I would like to see direction myself from the board, but I'm not saying asking for a list is bad. I would like to see direction.
Okay. Thank you. Thank you, Commissioner.
I had my hand up or a request or whatever. I think this is I believe this is just to get the conversation started with the health department to get the list going. The health department would then take it and guide from that point. And this is a peace of mind for our community and for the residents that call us, whether they dial in 100 times or they dialed in twice. It's a peace of mind to know that we as a board are trying to help them and guide them and get them what they're looking for. I think that's all it is for a start, just the start.
That's true, and I've been in communication with the executive's office on this resolution, and they don't view it as a hostile thing at all, but as an intention of the board to try to create a list so that it makes people easier to access the system. And what shape that takes is not necessarily trying to just yet, but we can see the results of the call for the list by some of the work that's been done by our department already. The smart waiting list is one perfect example of a list that was created as a result to try to have people, get some certainty when they're making efforts to try to make phone calls. So this is it's a good start, and it is open intentionally, I think, so that gives the department knows our intention of our board that we desire more lists and give them the flexibility to do it. So it's done in good spirit, and I think it's a step in the right direction. So check my list.
And Chair Brown, I don't see anybody else on the list. If it's okay with you, I'll prompt a new vote just since some discussion has happened.
All right, very good. All right.
And that motion has passed unanimously.
Very good. Thank you. Next item is item 14B, a resolution requesting additional doses of COVID-19 vaccination for older adults in the congregate care facilities. I need a motion on this one.
Motion by Haw.
Support Song.
Very good. Is there discussion on this item? Go ahead, Commissioner Mize.
Commissioner Song,
please.
Chair.
Yeah, so thank you. Thank you for raising your hands. I've got a technical issue. I'm trying to flip back and forth, so if I see your hands, I appreciate it.
I figured
Go
this
ahead, Commissioner Song.
And she got her hand up very fast.
I just want to say thank you, Chair, for putting forth this resolution and sending the state a request. And I think that it's important for us as a board to initiate that conversation and to kind of figure out what we can do to get more vaccine doses. So thank you for that.
Thank you, Commissioner Song. Commissioner Haw, did you have your hand up? Yes.
Yes, I did. Thank you, Chair. I just want to reiterate what Commissioner Song said and compounded with the multiple questions we posed to Vicki Wobler on this very subject. I don't think we need a whole lot of conversation on this resolution. I just hope it gets the attention that we're looking for by doing it. So thank you very much, Chair. It's all I have.
Thank you. Any other commissioners? All right, Michael, please call for the vote. Put the vote up.
That motion passes 12-0.
Very good. Thank you. Item 14C, resolution supporting Macomb County application for a grant from the Michigan Transportation Economic Development Fund for Category 8. So that came from Commissioner Farrington's committee. Mr. Farrington, do you want to make a motion?
Yeah, I'll make the motion.
Motion by support by Commissioner Sabatini. Any discussion on this item? Okay, please vote.
That motion passes unanimously.
Very good. Item 15 are proclamations. There's item 15A, a proclamation out of the Romeo District Library.
Chair.
Chair, we have one more resolution.
Yep.
Item D.
Oh, yes, I did. I'm sorry. Item D, I'm sorry, Commissioners. Designate fund for depositories for compliance of Act 40, Public Act of 1932 from the Treasurer's Office. Need a motion on that, please.
I'll make the motion, Farrington.
Support Haw.
Any discussion on this item? Please vote.
That motion passes 12-0.
Thank you, Commissioners. Item 15, proclamations. Item 15A, a proclamation out of the Romeo District Library for their 20th anniversary. That's offered by myself. Now, I need a motion to approve that proclamation.
Chair, I'll make the motion to approve A and B together.
All right, is there support for those?
Support Sabatini.
Very good. I'm going to speak on item 15B. This is a constituent happens to be in my district. It was offered by Commissioner Kraft. Thank you, Commissioner Kraft. But the Board of Commissioners would like to commend Andrea Cox on her Ditch the Trash project, a green initiative supported by local communities encouraging recycling and reusing efforts. The priority to develop greener economies require engaging young people throughout national programs and educational challenges. Andrea is a remarkable example of the power of this engagement for the future generations and the continuous challenges we face maintaining a more sustainable world. Andrea developed and organized the Ditch the Trash Day for her 8th grade Global Impact Project, a project which created a long-lasting impact for all participating residents and communities. She has successfully implemented a project with Ray Township and continues to advocate for other local communities. Macomb County Board of Commissioners publicly acknowledges and commends Andrea Cox for her achievement of the creation of the Ditch the Trash Day, an accomplishment which truly deserves public recognition. We want to thank her, and as we do, and as the new commissioners, you'll know, we do a Green Schools Initiative every year, and you'll be involved in that and learn more about that. But this is just more good things that have come through that initiative that we've had started for many years. And so I want to thank Andrea Cox for her leadership on this, and look forward to many great things as she develops her career. Commissioner Kraft.
Thank you, Mr. Chair. I think Andrea is actually here, and I would be honored to hear a little bit of what this project is from her, if that's okay with you, Mr. Chair.
Very good. Thank you, Andrea. Are you available? You are.
Yes.
You press *6. Very good. Why don't you tell us a little bit about your project?
So I started doing this project in 6th grade, and now I'm doing it in 8th grade, and I've actually implemented it this year, and I wanted to get it out to more communities.
So tell them what you're doing.
So Ditch the Trash Day is like, so everybody goes out and gets their garbage out of their ditches, and they can help out a neighbor. So.
Outstanding, Andrea. Thank you. Commissioner Kraft, do you have anything else?
What was
I'm
that?
all set. Just wanted to give her some time to shine. That's all. Thank you, Mr. Chair.
Very good. Very good. Thank you, Andrea. And stay in
Thank
touch,
you.
okay?
Okay, thank you.
Congratulations. We've got a motion made and supported. Please vote on 15A and B.
That motion passes 12-0.
Very good. Thank you, commissioners. Item 16 is new business. I have a bit of new business. The board has always placed a high value on the contributions made by the many volunteers that live in our county, whose efforts benefit our communities and the county as a whole. In April, for the 32nd year in a row, this board intends to honor our outstanding volunteers in Macomb County through a volunteer recognition program. Because of the pandemic, we'll run our program a little differently this time, but the end result remains true to our program and its mission. The staff will be sending out information to all commissioners soon to alert you that we will be looking for each commissioner to identify and nominate one outstanding volunteer from their district. There'll be more information on this going forward, but we'll be doing a volunteer recognition program, and given the fact that you're all in touch with your communities in so many levels, that you could help identify a volunteer that you could nominate to be recognized as a volunteer of the year from your district, and we'll recognize them at the board level and give them a proper recognition. So stay tuned. Staff will be sending information on that. It's a very good program, and it's been very popular. So with that, is there any other new business from commissioners? Don't see anybody's hands. I don't hear anybody speaking there. So we'll close new business. Item 17 is public participation. Anyone from the public wish to be heard on any item not on the agenda, or any item for that matter. Staff, do we have anyone online or on the phone that wish to be heard?
Chair, there is no one currently in the chat box. Oh, no. Yes, there is. Joel Rutherford.
Mr. Rutherford, thank you. You have 5 minutes to speak on any subject you'd like.
Thank you, Chair Brown. Good afternoon, commissioners. I just want to thank you for your vote for setting up this list in order to, let the health department and others determine exactly, what the protocol will be on that. I think it's important because, as you can see, both Meyer and Rite Aid, and even with SMART, they're using a list system. So I'm glad to see, this moving forward, because I think it's something that's really important, because I know even for myself, after the hundreds of times I've called on a Tuesday, I was fortunate enough to get in and able to get a shot. Once you're in and you have that appointment, everything works exceptionally well, like it's been stated by others. So that's something that I'm really glad to see the commission move on, because I just think it's important. I think it's something that, it's not about, right or wrong. It's about what's best for the residents of the county. I do want to give a special shout out to Andrew Cox and also his colleague, Natalie Dean Wood. They helped us provide a COVID vaccine town hall last Saturday that was well attended. Because the big thing is as Commissioner Wallace and both Commissioner Song have said, we're trying to get that information out, especially to communities of color, because too oftentimes there's been such an apprehension that people are afraid this is a historical thing, but we're trying to make sure that people understand that, let's face it, there's no plan B in that sense. If you don't get the vaccine, you're really taking such a risk of possibly contracting it and dying from it. And I'm also glad to see there is an emphasis on seniors, because I know that the state's using SVI as far as what they're doing on that, and sometimes that seems to be such a complicated system. But those over 70, age 70, account for 3/4 of the coronavirus fatalities in Michigan. The higher death rate for seniors is consistent across racial and other demographic lines. So all I can say is there's something that, everybody's doing their best. We obviously just need more vaccines, and hopefully in time that'll certainly happen. I know one thing I would like to ask, I know it's something I've talked to Andrew Cox about, it's not new to him, but on the dashboard that shows vaccines that have been given, I'd like to see that broken down as far as age, sex, and also race. I think that transparency is needed, because people can look at it and see how many vaccines have given, but who's getting them. I think that's also really important, because I think it would help to say where's emphasis needed and where do we need to put more effort or energy into, maybe there's certain groups that aren't getting the vaccines, at least by the numbers. So again, I thank you for your vote, and have a good evening.
Thank you, Mr. Rutherford. Anyone else who wishes to be heard under public participation, those of you who are on the line, on the phone, you could press *6 and unmute yourself and join us. Or anyone in the chat box as staff.
Chair, there is no one else in the chat box at this point.
Okay. One more time, anyone online who want to unmute their phone, they could have a chance to speak. Seeing none, we'll close public participation. I need a motion to adjourn.
So moved by Romano.
Support from Kraft.
All right. Motion moved and supported. Please vote.
And that motion passes 12-0.
Very good. Thank you, commissioners. Enjoy your evening, and we'll talk soon. Take care.
Good weekend.
Have a good evening, guys.
Take care.